because then it's more likely to get asked. Okay, so now I'd very much like to welcome Julia Thrift, who is going to give us a presentation on leisure, culture and healthy lifestyles. Thank you, Julia.
Thank you very much, Angela, and thank you all very much for inviting me to be here today. My name's Julia Thrift and I work at the TCPA, the Town and Country Planning Association, where I'm Director of Healthier Placemaking. Next slide, please. The TCPA, the Town and Country Planning Association, is a charity, so we're completely independent and we work to help people create healthy, sustainable and resilient places that are fair for everyone. And we do that in all sorts of different ways. We've run more than 50 workshops with councils and communities and public health teams and planners in different parts of the country, bringing people together to think about how their new local plan could help create a healthier place. So I'm really pleased to be joining you here today. I'm sorry it's not in person, it would be lovely to meet you, but it's the next best thing. So over the last few years, the TCPA has been doing a lot of work around planning healthier places with partners such as Public Health England and NHS England, and we publish a lot of guides which are on our website and free to download. Next slide, please. So I thought we should start by thinking about what is health before we start talking about it. And the most commonly accepted definition is the World Health Organization's definition. And what they say is that health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. So what that says is that health is not just about not being ill, it's much more about flourishing and doing well. It's a much more positive thing than just the absence of illness. And I thought it'd be worth keeping that in mind as we think about how your new local plan could help support the health and well-being of your community. Next slide, please. So what keeps people healthy? In this country, because we have such a wonderful NHS, when we think about health, we often think about the NHS, but in effect, the NHS is really good at fixing us after something's gone wrong, but it's not actually what keeps us healthy. And all the research and learning shows that the things that keep people healthy are the places and the communities in which they live. So if you look at that circle diagram, in the middle you've got the things that you can't change, like you can't change how old you are, you can't change your genetic makeup, and those affect your health. But the other things in the other circles are things that can be changed, and they have a huge effect on your health. So your lifestyle is affected by where you live. Whether you choose to go for a walk in the park depends on whether there's a park nearby, and if there isn't one, you won't. So your choices are shaped by the place you live, and so are your opportunities. Whether or not you have a job is shaped by the local economy, and having a job is really helpful for people's health. The built environment, the homes we live in, are really important for our health, as is the natural environment. And I think all of this has become much more apparent over the last year, when we've all suffered from the effects of the coronavirus pandemic, but people's experiences have been vastly different depending on where they live. And if you've been living in a home that's safe and secure and has enough space for you and maybe has a garden, your experience would be very different from somebody living in an overcrowded home that's perhaps falling apart and they're worried about being evicted. So the places we live in, the homes, the neighbourhoods, the communities, influence to a very great degree whether or not we're healthy. And planning and the way that planning shapes the environment therefore has a very important role to play in helping to create places where it's easier for people to be healthy. Next slide, please. So before the pandemic, there was an epidemic of avoidable illness. So the British Medical Journal estimated in 2018 that half of all doctor appointments could have been avoided, because the illnesses that people were going to the doctors with are things that could have been avoided. I think that's a really shocking statistic, because we know how busy the NHS is. And what that's saying is if we could help people to live healthier lives, we wouldn't need so many doctors. The cost of running the NHS would be far less. But perhaps more importantly, an awful lot of people wouldn't be suffering ill health. And the sort of things that cause ill health, we often hear about at the moment underlying health problems that unfortunately people who've caught COVID, if they had underlying health problems, they've fared much worse. And the things that cause those underlying health problems are things like loneliness. And we sometimes think of loneliness as not terribly important, but in fact, the research shows that it has just as bad an effect on people's health as smoking. It really is that bad for your health. And it's not just old people who are lonely. People of all ages suffer from loneliness. Many of us are overweight or obese, including children. We have a very high level of childhood obesity in this country. And children who are overweight or obese will have, or are likely to have, health problems for the rest of their lives. So it's just so important we help children maintain a healthy weight. And the food we eat is one of the biggest causes of ill health. It causes numerous different health problems. So again, if we'd gone into the pandemic with a healthier population, we might have had a slightly better result from it. So it's really important that we help people keep healthy as best we can. Next slide, please. So some of these problems that have been around for years, I think, came to the fore in the last year when it became so apparent that many people are living in poor quality homes and neighbourhoods that aren't particularly good for their health. Many people live with poor health, and poor health and poor environments and inequality and poverty are all very much interlinked. And in the UK, there are stark health inequalities. And what that means is that one group of people might live for 10 or even 20 years longer than another group for reasons that could have been avoided. And similarly, there are some groups of people who are much more likely to spend many years in ill health. And I suppose what we all hope for ourselves and our families is that we could have a long, healthy life, and not a short life, and not a life where many, many years are spent with illnesses. So the question is, how can we shape our environments to help everyone have a long and healthy life? Next slide, please. So the things listed here are all really important influences on health and can keep us healthy or not. So physical activity, the diet, whether we have enough food and whether it's good quality, nourishing food, good local green spaces and parks, and connections with people and places. And I think we've seen in the last year how important it is to have neighbours and friends, and how that really supports people's well-being. So living in a community where you feel safe, where you know people, where you've got somebody to turn to if you've got a problem, all of that really supports your well-being. So as we think about developing new places, it's really important to think about how we can create places where people meet their neighbours, excuse me, where it's easy to bump into somebody and have a chat. Next slide, please. So just thinking about physical activity, it's been described as being so important that if it was a drug, it would be called a miracle cure. Keeping active helps in so many different ways, from reducing depression to warding off cancer, different sorts of cancers, to helping to prevent bone fractures. Keeping physical activity is just so important for everybody, keeping physically active. And this isn't about being a marathon runner or a super sports person. This is about day-to-day physical activity is really good for us all. You're going for a walk, walking to the shops instead of driving, taking your kids to the park. That sort of daily activity is incredibly good for people's health. So the more opportunities we can provide that make people want to go out and be active, the better it'll be for everyone's health. Next slide, please. And one way of helping people be active is what's known as active travel, which is walking or cycling or scooting, any way of getting around that uses up some energy. Because you can fit that into your daily life. You don't particularly need equipment. I mean, it's lovely to have a bike, but if not, you can walk. And you don't have to go to a particular place. It's not like going to a gym where you have to pay for a membership and you have to have the right clothes and you have to get there at the right time. If we can help people walk or cycle or move as they travel, then we can build in that everyday physical activity in a way that's easy to do without even noticing. So as you think about the local plan and how Uttlesford might change over the next few years and what the opportunities are, it would be great if you can think a bit about how it would be possible to help people be a bit more active. And active travel is one way of doing that. So would it be possible to make walking and cycling easier? There might be places in urban areas where it's possible that perhaps some of the roads could become a bit more friendly for pedestrians, or the traffic could be slowed or perhaps kept out of some areas. And it might be in rural areas that people do need to travel by car or by bus to get to the next town. But when they get there, do they have everything they need? Or do they then have to get back in the car and go to another place to get the next thing they need and then another place? So if you can make sure that towns and villages have a range of different things in them, that can help people know that they only have to make one journey. And when they get there, could it be a pleasant place to walk around? Are there things to see and do? Can you bump into people and have a chat? All of those are really good for our health. Next slide, please. And having good quality parks and green spaces nearby has so many different health benefits. There are multiple benefits. They're good for our mental health. Sitting or strolling in a park or a green space is incredibly good for people's mental health. I think it wasn't surprising after the first lockdown that so many people wanted to go to the park or walk in the countryside. It's incredibly good for us, and I think we all appreciate that. It's great, obviously, for kids to run around. Trees also provide other health benefits. In town centres, having trees can help keep the temperature down, which, as we're getting hotter and hotter summers, is really important. So it can save on air conditioning if you have lots of trees. They provide shade and they release water, which helps cool things down. They're also very good for reducing flooding. So having local accessible green spaces is really important. And in towns, that could be a local park. But in the countryside, are there public footpaths that people feel confident about using? Are they in a good state? Do they go somewhere nice? Is there any way you can help people feel that going for a walk in the green space would be a good thing to do? Because all of that will help people's health. Next slide, please. I mentioned that another big influence on people's health is diet, the food that we all eat. And in some urban areas, there are lots and lots and lots of hot food takeaways and very few opportunities to buy affordable, fresh fruit and vegetables. And it's no wonder that people end up, particularly if they're busy, if you're working long hours, grabbing something from a takeaway rather than going to a lot of trouble to find fresh fruit, fresh vegetables if they're not easily available. It's also really a good idea to provide places where people could grow a few veg if they wanted to. Might not be an allotment. Traditional allotments are enormous and take a lot of work, but smaller spaces around and about can be really good. Can be a great way for communities to get together to grow things together. And also it's really good for kids to see where fruit and vegetables come from, that it's not just in a plastic bag from the supermarket, that they're normal things that are just part of everyday life. So thinking about how, as Uttlesford and the many villages and towns that you have might change over the next 10, 20, 30 years, can you think about creating places where healthy food is easily available. Next slide, please. And then finally, if we're thinking about helping the least healthy people be a bit more healthy, it's important that we think about the needs of people who aren't super fit and healthy. It's great to provide bicycle lanes, that's fantastic. But if you're very elderly, or you're not very well, or you're 8 months pregnant, or you've got 3 kids in tow, you're probably not going to get on a bike soon, but you might go for a walk. And you particularly might go for a walk if there's somewhere to sit along the way. So making sure that the spaces we have work for everybody and not just people who are fit and healthy is really important. So benches, signposts, all of that can be really good to creating different places that will appeal for different needs. So yes, have a football pitch, but also perhaps have a little garden where somebody can sit quietly. And during the first, after the first lockdown, we saw quite a lot of park benches being roped over so people couldn't sit on them, which actually was a really bad idea from a health point of view, because that means that the only people who could go to the park are the people who are confident to walk quite a long way. And we really need to make sure that everybody feels confident to walk, and that means providing places to stop and have a rest. And also enough public loos. So often people, particularly elderly people, will say that they're cautious about going out because they don't know if there'll be a loo. So all of these things can help make going out and getting a little bit of exercise a fun, interesting, nice thing to do and not off-putting. Next slide, please. And I mentioned the importance of knowing your neighbours, of feeling part of a community and how that really supports well-being. And that happens when we meet people, when we bump into people, when we get to know our neighbours. And for that to happen, we need to have spaces for things to happen. We need to have spaces where there can be markets or events. We need to have spaces where kids can run around, spaces where people feel happy that they can go, that they can sit, that they might meet someone they know, that they can have a chat to, because those informal chats can be really important. And particularly for people who are living on their own and might not be talking to people during the rest of the day. If they know they can pop out and bump into someone, that's so important for people's well-being. And it can be difficult to find, you might not have the space or the money to have a community hall, but you could have something that plays a different role. So it could be one thing during the week and something else at the weekend. There's ways of thinking creatively about providing those spaces for activities and events. Next slide, please. And finally, it's just so important to have places where cultural things can happen, where you can have, whether it's theatre or poetry or skateboarding or art or whatever it is. Different people will find different things appealing, but you need to have somewhere where those things can happen, because again, that's what creates a sense of community and belonging. And when people are thinking about where would I like to live, people want to live somewhere where things happen, where they can feel part of it, where they can go and see things and do things. So again, as you think about the local plan, really important to think about where things can happen in different places, whether it's towns or villages. Next slide, please. So that's it. So I hope that's given you some food for thought, and I'm very happy to take any questions or listen to any reflections you might have. Thank you.
Julia, thank you so much. That was really, really helpful introduction to what is a very